Okay, come back to this question of your body image, which is how do you feel about yourself as a person? Because I think the viewers would like to hear more about that. And you told me about that quite extensively last time.
Yeah.
Certain cancers do affect appearance and certain ones don't. I'm not saying those that don't are easy to handle by any means, but those that do affect your appearance have a special layer of complexity, which is that other people then see you for a changed person, perhaps, at least initially, when they think, you know, people tend to spot a change and then they get used to it. Do you know what I mean?
Absolutely.
And what did you find about going out and visiting friends and seeing the public?
It was very, very difficult. I became a bit of a recluse to start with. I wouldn't even go out the house.
Yeah.
And this, of course, concerned other people. It concerned Julie especially, my wife, but it also concerned my friends, my relatives, because I wouldn't even see them.
So you were a bit avoidant of going out?
I had avoided them, yeah, definitely.
Yeah. Did you even allow them to come round to you?
No, I wouldn't have them come round because I didn't want anybody to see me.
Yeah.
So the way that was broken was quite amusing, really. It was my golf pro. He was on the phone to Julie all the time, and Julie was on the phone to him, letting him know how I was getting on, and my other relatives. But he weren't going to accept the fact that he couldn't see me. And he was a great guy, and he came round one day and knocked on the door, and Julie said, "Look, Chris, his name is, Chris Diageo, great chap." And he said to Julie, look, Julie said to him rather, "Chris, he doesn't want to see anybody, he's refusing to see people." So he said, "Just step aside."
Yeah.
And he came in and he says, "You're going to have to see me, Alf, you know, because, you know, you can't not get back to how you were."
Yeah.
And that was the bit that encouraged me, really, I suppose, because he wasn't shocked with what he saw. And at this time, you've got to bear in mind, I was still a mess to look at.
Yeah.
So eventually, with his help, but nobody else's, you know. This is a bit where I get annoyed. I mean, I know we've got this psycho-oncology unit. That psycho-oncology unit should have been with me right from the beginning. Right from the beginning, because I was suffering.
Yeah. I
was suffering mentally with the way I felt about myself, because I felt I looked horrific. I did actually, but I think I probably overemphasised the fact that it was as bad as it was, because other people said it wasn't. And it was a Macmillan nurse who recommended that I should have some help from the psycho-oncology team, which again surprised me, because I thought that my doctor would have done that. But apparently the doctor didn't know anything about the psycho-oncology unit. That, I hope, can be sort of amended at some time.
So you would have appreciated if that help from our team had been pointed out to you in an earlier phase, and you could have benefited from almost day one.
When I first started having treatment with the psycho-oncology team, I felt an enormous relief. I felt an immediate help. I felt there were some people there who knew what they were talking about, who could help me. That came across loud and clear. Both myself and Julie, my wife, felt the same thing. We did have a bit of a disagreement with yourself, Alec, because I didn't understand where you were coming from, but there I was in such a mess. But from then on, I think that what you've done, what Sue Todd's done, has been so beneficial that I think I shouldn't have suffered them months and months prior to meeting up with the psycho-oncology team.
I mean, the message I'm taking away is also that other people in a similar position should access, if available, similar services, and ideally services like this should be available elsewhere.
Absolutely, absolutely. See, when people talk about mental health, we look at places like Broadmoor and things like that, but that's, you don't look upon it as yourself. I didn't think that I would need mental help, and yet, because of what I went through, it was thrust upon me and I had no control over it.
Did you mind being referred to us in the early days?
Did I mind? I think I was a little bit reticent about going, because I didn't want to be thought that I was mentally ill.
Yes.
And I don't regard myself as being mentally ill.
No.
I regard myself as suffering a mental problem.
Yeah. And I think we would try and frame things with most people who come to see us as that you're struggling with an emotional issue that we don't necessarily need to put a label on, but we'll help you anyway. We'll just do, you know, even if you've got a mild issue, we'll give you an appropriate intervention. If you've got a major issue, we'll address that too. You know, we're not scared to address that.
That's what I'm finding. I'm finding that I have a sleep problem because of what's gone on, and I've had great help with that.
Yeah.
You know, I have this fear of meeting new people. I've got over that. I can go into a restaurant now. I must admit that sometimes when we go into crowded restaurants, I tend to sit with this side of my face against the wall, away from the other people, but I'm not afraid now to go and meet strangers.
So what was it like then, venturing out and getting kind of feedback from people, some of whom you didn't know? It must have been scary to put yourself in that situation.
I was frightened to death, to be perfectly honest. I thought everybody was looking at me. I felt like the Elephant Man. I thought that, you know, what had happened to me was so disfigured that people would be attracted to it like a magnet. But that weren't the case.
What was the case?
The case was I wasn't being noticed.
Really?
Yeah, but it took me a long time to realise I wasn't being noticed.
Yeah.
And I think, I've said this before, and I've said it on a previous time, about this little boy I met.
Yes, tell us that story.
Yeah, we ventured out, Julie and I, to a supermarket. And this was my first trip to a supermarket since the operation. And I knew it was going to be in close proximity with people who would, if they were going to notice it, would notice it. And Julie was talking to a woman over a fridge, and they were discussing prices, as women do, about things in the deep freeze. And they had a little boy there, about 8 or 9 years old, this woman, and he kept looking at me. And at first, it sort of worried me. But then I saw in his face, like, this sort of curiosity. He was looking at me with interest, if you like. And so I said to his mother, I said, look, I've got a disfigurement. I said, but your little boy keeps looking at me, can I talk to him? She said, certainly, you know, I mean, she was a lovely lady. So I sort of got down on my haunches, and I said to him, are you looking at my face, sunshine? And he said, yeah. I said, well, because he's looking up, you see, and he could see that under these glasses, I didn't have an eye. And because of his curiosity, I gave him a little story about how it came about and what it was. And I said it was cancer, and I'd had a big operation to get rid of this cancer, which is very, very naughty disease, and it's not the sort of thing people want. And I said, and he said, well, how did you get the cancer? And at first I was a bit lost as to what to say, but then I said, well, I believe it was because I used to smoke cigarettes. I said, nobody's actually said that, but that's what I think it was. He says, you know what, mister, you have to excuse me, because this was a life-changing moment. He says, I'm never going to smoke. I said, sorry, and what that little boy said did so much for me, because if nothing else, that little so-and-so ain't going to smoke, he's not going to get cancer. That's how I looked upon it.
Yep.
And bless him, he made me feel so good that day, because I was able to open up to somebody. I know he was only a young lad, probably doesn't fully understand it, but I think I did a bit of good there. I
mean, from my perspective, you were in a slightly vulnerable position, having just ventured out, and you had that interaction, which, you know, was a sensitive one. It could have gone badly in a way, but it didn't.
No.
You both benefited from it. And then, you know, maybe there was, you can take on board that venturing out can have positives in life and as well as negatives. You know?
Yeah.
It's not just going to be bad things that are going to happen.
That little boy, he did a lot of good for me. He really did, because hopefully that he'll remember that for the rest of his life.
Certainly, certainly.